Herzlich willkommen, liebe Zuschauerinnen und
Dear viewers, welcome to our presentation on natural medicine. In short, when the immune system is weak or completely overwhelmed, microimmunotherapy can become very valuable. I will discuss this topic with Dr. Petra Wiechel from Wismar and Chief Physician of the Swiss Mountain Clinic.
Wir sind gleich zurück. Dr.
Wiechel, welcome and thank you for being here.
Thank you for your invitation.
It's my pleasure. I keep hearing the words microimmunotherapy, but I never really knew what it meant. Would you tell us more about this?
Yes, microimmunotherapy was launched 30 years ago by Maurice, who was a great homeopath. Although this is not about homeopathy, if you practice holistic thinking, you must understand how the human body and its immune system work. Basically, it means that we cannot observe something from the outside if we just look at it separated from the whole. The number of isolated parts does not make the whole. So we must always see the whole and its parts as a symbiosis, of course.
Okay, there I completely understand you. That's the drama in conventional medicine, isn't it? Looking only at each individual part, knowing that they are in symbiosis with each other. Isn't that an issue?
Right. If you look at the organism, or more specifically the immune system, you see that it has evolved for years, millions of years, constantly adapting to the life of humanity. It's crucial to understand that it is really an open system. And this open system is very special because it must deal with the development of disease, with bacterial viral processes, in a way as not to harm the body.
Sich mit Krankheitsprozessen, mit bakteriellen, viralen Prozessen in einer gewissen Ordnung auch auseinanderzusetzen, ohne dass der Körper Schaden nimmt. Das läuft alles.
Although we do not perceive such processes, we know they happen in certain ways.
Dem dürfen wir aber auch vertrauen, dass nach dieser Ordnung arbeitet.
How does that relate to your special field, biological medicine? The human body is always in balance, and every disease is the best possible response of the body to the circumstances. You define things very differently and somehow make them more understandable.
You also understand, in the context of this immune response, that interrelationships are not linear, that they strengthen each other. For instance, through positive feedback, they may also partially reduce themselves in the immune response through negative feedback. This is extremely important to understand, and at that moment, of course, to achieve a greater purpose.
Was es erfährt, wem es standhalten muss, was es aber auch schützen muss.
This means the immune system is in a daily confrontation with what it experiences, what it must withstand and what it must protect. It must not confuse the enemy with the friend, and it must not attack its own organs, its own cells, but rather, it must always be ready to face what appears as a stranger. Let me put it this way. The immune system must understand this relationship and react with a very high sense of responsibility to all the dangers of life, while we humans have no influence on the process. And this no longer happens when our immune system is confronted with things that prevent it from this self-regulation.
Such as?
Well, may I say, for example, do I still have an amalgam in my mouth, or I still have a highly toxic load? We talked about this in one of your programs about gluten sensitivity. That is, when nerve cells have the same recognition receptors, due to malnutrition or also due to many chemical substances, which are normal for our body. Nerve cells are attacked and neuroinflammations take place in the head. This doesn't help our organism to maintain a healthy and strong immune system, and these interactions, which take place without attacking cells in any form, overreact to an allergy instead of reducing it. If it comes to illness, it's not a wrong decision of the body, but a necessary decision, because the immune system has attacked something, must do something for us, and inflammation is the result. Microimmunotherapy is not based on homeopathy, because homeopathy works only on the symptom. However, microimmunotherapy works on the cause, which means that it helps to identify the cause, the disturbance of the immune response. And that's very interesting, because I adjust myself every day to this huge system that will keep me free from viral reactivations and from bacterial infections.
Weil ich habe ja in dieses riesengroße System, was sich ja jeden Tag mir als Mensch anpasst und mich frei hält eigentlich von
In that case, I cannot go in only with a crowbar. An allergy is not treated after all if I take an anti-allergic drug. At this point, it may only stop my eyes and nose from watering. But in fact, these symptoms are out because my immune system can't tell who's the friend and who's the enemy. It overreacts. Allergy is always an overreaction, and the disturbance lies in the immune system.
Mein Immunsystem kann den Freund von dem Feind nicht erkennen. Es schafft eine Überreaktion. Allergie ist immer eine Überreaktion.
This disturbance is not the pollen out there or the apple that I'm eating now, is it?
Liegt doch nicht in dem Pollen da draußen.
Instead, the microimmunotherapy tries to understand what happens during an allergy process and tries to modulate it in such a way that tomorrow I'll be able to face it with a certain immunogenic strength, the pollen, for example, or the day after tomorrow, the Kurtz allergens in apricots.
Aprikosen zum Beispiel wieder mit einer gewissen immunogenen Stärke.
This is highly interesting because it sounds incredibly complicated now, but if the therapist who practices microimmunotherapy also adheres to the circumstances, things will appear more clearly. Then she has in her hands a wonderful therapy that precisely addresses the causes of this misregulation, and that is fascinating.
I haven't quite understood what microimmunotherapy is all about. Are they also globule? Or for more explanation, are they also informed waters?
No. So it's like this. The immune system uses the immune cells. So these are leukocytes. The white ones are lymphocytes, the so-called cytokines, which are secreted proteins and signal molecules. The entirety of my immune system undertakes different tasks, and these are used in the context of microimmunotherapy. In other words, they are interleukins proteins with a tumor necrosis factors receptors and a messenger substance that guarantee an intact immune defense in the interaction. And by the fact that one does not swallow a capsule, but only opens it and scatters the contents into the mouth, the substances of the capsule, which is packed like a homeopathic drug, will dissolve in the mouth and immediately be available to the immune system via the lymphatic system, which now responds by regularly adapting itself.
dem Immunsystem präsentiert, auf das es jetzt sich
Each package has a blister of 10 capsules, 3 times 30 capsules, and in each blister is a different dose.
10 Kapseln. Jede Packung hat ein Blister mit 10 Kapseln, 3 mal, 30 Kapseln.
According to the
Und in
Aunt
jedem
Schultz
Blister
rule
ist
of homeopathy, a
andere
small
Dosis.
stimulus creates a
Und
high
die
level of
Arndt-Schulze
regulation.
Regel der
A
Homöopathie
large
ist,
stimulus
kleiner
creates a
Reiz
small
schafft eine
level of
hohe
regulation.
Regulation,
And so,
großer
from one
Reiz
capsule
schafft
to
eine
another,
kleine Regulation.
it's about
Und so
strengthening
geht es
the ability to
von
regulate.
einer Kapsel zur anderen, um die Regulationsfähigkeit immer
This
weiter
means
zu
that I
stärken.
train
Das
my
heißt,
immune
ich
system, because in the
trainiere
case of
mein
an allergy,
Immunsystem, weil es
it does
kommt
not
bei einer
depend on whether it
Allergie
is
nicht darauf
triggered by
an,
the
ist sie
pollen,
ausgelöst
or
durch
the
den
apple,
Pollen oder
or
den
the
Apfel oder
apricot,
durch
or
die
the mother-in-law.
Aprikose oder die
But it is the
Schwiegermutter,
same system of an
sondern
overreaction,
es
an
ist
allergy,
das
repeatedly.
immer wieder gleiche ablaufende System einer Überreaktion, einer
And I make
Allergie.
use of that by giving the
Und
immune
das mache ich
system, for
mir zunutze,
example,
indem ich
these
dem
two
Immunsystem,
allergens.
also zum Beispiel das 2L-Allerg bei einer Allergie.
In the
Ist ganz
case of an
wichtig, dass ich
allergy,
das jetzt schon 2
it's
Monate
important that
vorher
I
vielleicht
possibly
schon mal
take this
einnehme,
2 months in
jeden Morgen so eine
advance.
Kapsel in den Mund
Sprinkle a
streue, um
capsule
mich
like this
dann
in my mouth every
von Jahr
morning
zu Jahr
to stabilize my
meine
defenses from year to year so
Abwehr
that
so zu
after a
stabilisieren,
while
dass ich
I
nach
no
einer
longer
Zeit gar
have an
keine
allergy
Allergie
or
oder
an
diese
overreaction to
Überreaktion mehr beim
apples
Apfel
or
oder
whatever.
irgendwas, was ich habe.
Und die sind für
And
alle
they are
gleich,
the
oder
same
jeder,
for
der
everyone?
Nee, die sind nicht für alle
No,
gleich.
no,
Das
they're
ist
not the
jetzt
same
eine
for
unheimliche
everyone.
Entwicklung im Laufe der
For
letzten
the last
Jahre,
years, there
die
were
natürlich,
tremendous
da kann man nachher noch mal
developments
drüber
in
sprechen,
microimmunology,
was kann man
which of course we can talk about
mikroimmunologisch
later.
unterstützen. Aber wichtig
It's
ist
also
auch, dass der
important that the
Therapeut
therapist
jetzt nicht
doesn't
einfach,
simply
er
see
kann
that the
schon,
patient has
wenn er
herpes
zum
zoster, for
Beispiel ein
example.
Herpes zoster hat, den
He
sieht
also
er ja.
knows that
Und
shingles
es
is
weiß er auch,
triggered
dass
by
eine
herpes zoster viruses.
durch Herpes zoster Viren ausgelöst wird. Dann kann
Then
er
he can
schon
already choose a
ein
microimmune
Mikroimmunmittel
remedy
wählen,
which leads the
das
herpes
genau an
virus
dem
back into
Punkt
inactivation.
das Herpesvirus wieder
Shingles
in
is an
seine
acutely
Inaktivierung
reactivated
zurückführt.
herpes
Eine
disease.
Gürtelrose ist ja eine
This means that
akut
the herpes viruses are
reaktivierte
dormant in the spinal
Herpeserkrankung.
cord,
Das
and it takes
heißt,
a
die
lot to wake
Herpesviren
them up.
schlafen im Rückenmark.
An immune
Und es muss schon
deficiency
einiges
must happen for the
passieren, dass die
herpes viruses
aufwachen.
to
Es
become
muss schon eine
active.
Immunschwäche passieren,
For
dass
example,
die
in the
Herpesviren
past, I had
aktiv werden.
chickenpox. I
Weil
went through it,
früher hatte ich
and the
Windpocken,
viruses
habe sie
remained
durchgemacht
inactive.
und die bleiben
They can
inaktiv.
remain
Die können mein ganzes
inactive
Leben
my
lang
whole life,
inaktiv
but if they
bleiben.
do,
Aber wenn,
it's
dann
not
liegt
because
es
of the
nicht an
herpes
den
viruses,
Herpesviren,
and I don't
die
have
habe
to
ich nicht
destroy
durch
them
ein
with an anti-herpes virus drug like
Antiherpesvirusmittel
Zovirac.
durch Zovirac zu zerstören, sondern ich habe zu verstehen, dass
I
mein
must understand that
Immunsystem
my
die
immune
Präsenz nicht
system
mehr hatte,
no longer had the
dieses
presence to
Herpesvirus
leave
in
this
der
herpes virus
Inaktivität zu
in
lassen. Wie
inactivity.
neulich eine Patientin da war,
The other
und die hatte
day,
eine
I had a
schwere
patient who
Gürtelrose
had
im
severe
Gesicht,
shingles on her face,
ganz doll
very painful.
schmerzhaft. Das war schon viele
It
Monate
had been like
so.
this for many months,
Und
and we know that her
die
cat
Katze
was
wurde
run over.
überfahren. Die Katze war aber
This
18
cat
Jahre
had been a member of the
ein
family for 18
Familienmitglied.
years, and I
Und
think
ich
I
glaube, ich
mentioned
hatte
this
das
example
Beispiel schon mal
before.
genannt. Und einen Tag
One day
später
later, her
fällt ihr
husband
Mann
falls
vom
off a
Stuhl
chair
im
in a
Restaurant. Und
restaurant,
das war der
and that was the
zweite
second shock.
Schock. Das war ein Schockerlebnis. Auch jetzt
The
das
loss
Liebste
of the
im Leben
dearest
zu
thing in
verlieren.
life the
Und
very
am
next
nächsten
day
Tag,
was a
wenig
real
später,
shock.
kam die Gürtelrose.
A little
So
later
läuft das
came the
ab.
shingles.
Das heißt, hier gibt
That's
es
the
eine
way it
starke
goes.
Immunschwäche. Und das ist die Indikation für die
Obviously, there's a strong
Mikroimmuntherapie,
immune
die jetzt nicht
deficiency,
mehr den Nachweis
and
einer
that's the
reaktivierten
indication for
Herpesbelastung benötigt,
microimmunotherapy,
sondern
which
da kann
now
ich
no
sofort
longer
mit
requires the
Mikroimmuntherapie
detection of a
beginnen.
reactivation.
Aber in der Regel ist es so, dass der
But there,
Therapeut
I can
schon
immediately start with
im Vorfeld einen
microimmunotherapy.
sogenannten Immunstatus macht.
However, the therapist already
Ein
does a so-called immune status
zeigt
in
uns eine
advance
Übersicht
that
über
shows us an
alle
overview of all the classifications of the immune system.
Klassifizierungen des Immunsystems.
It is usually
Da
the
geht's
case.
die Lymphozyten, da geht es B-Lymphozyten.
I'm thinking about the
Da geht's
lymphocytes,
die
about B lymphocytes, about the T4 cells, the CD4,
sind unterschiedliche
the CD8
Fraktionen des
cells.
Immunsystems. Da
These
geht's
are different
die
parts of the
sogenannten
immune
regulatorischen
system.
Zellen, die bremsen, die
It's about the
abdämpfen.
so-called
Und
regulatory
allein aus
cells
diesem
that slow down, that
Immunstatus
fight
kann man
off,
sehen, ist das
and just from this
Immunsystem
immune status alone,
überreagiert,
you can see
muss
if
ich
it is the
es
immune system
in
that
einer gewissen
overreacts.
Hinsicht wieder
In a certain way, do I have to normalize it,
oder
or is it
ist es
way too
eigentlich
low in
seiner
its
Abwehrgrenze
defenses?
niedrig? Hat es zu wenig B-Lymphozyten?
Does it
Hat
have
es zu
too
wenig
few
gesamte
B lymphocytes?
Lymphozyten?
Are the overall lymphocytes insufficient? In that case, it's in a very strong dominance. Then comes the decision that I must take. Which microimmune agent do I use now that I modulate? So it isn't a therapy against. I start to bring the immune system slowly back into balance, which enables it to recognize and attack the tumor cells, so that the bacterial defense gets under control again. And exactly on that basis, I can see the various pillars that are now open. It is often shown in a diagram, and I must know very precisely in advance, do I have to stimulate this even more, or do I have to modulate it? That's the power of microimmunotherapy. This is unbelievable in the context of inflammatory processes. If I find out now that there are silent inflammations that I notice, but which I perhaps may also not notice, which means that osteoarthritis inflammation, joint inflammation, all of that can be integrated into the reaction of the immune system as well, and in the course of a treatment.
Does that mean that today our entire immune system runs on full blast?
No, it's quite the opposite. Humans are rather in a hypoimmunogenic situation.
How can you explain this? If I look right now at these inflammatory cascades, is the immune system expected to work even more, or has it resigned?
No, I don't say it resigned. But if I see, for example, that we talked about the intestine, about constant inflammation of the intestinal mucosa, that is also a hotbed for lymphocytes. That is, if there is a constant attack due to inflammation, then of course the immune system is also constantly in an incredibly high readiness to fight off these inflammations. Whether that's the gluten or parasites, whether that's the enterotoxins, whether that's the ammonia from malnutrition because too much protein is eaten or causes scatal hydrogen sulfide, whether it's the fungi, whether it's the viruses, the immune system must work in constant bombardment, and this phenomenon of exhaustion shows in a blood count as too few leukocytes. One often passes over it and says, well, that can already regenerate again. Lymphocytes are often shown to be over and above this. But if lymphocytes are also too low, as valuable in the context of tumor defense, then it means my immune system is not present enough. And in addition, sometimes not only is the number lower, but the immune system keeps up with an attack of the immunity but goes too far. This, of course, is a form of therapy, and I must also pay more attention to this person. Furthermore, of course, I also have to recognize under which load is this immune system. And if, for example, it's normal for me to have a pizza in the evening, then problems will be obvious. Or if it is that I'm not going to bed until after midnight, then I know that my immune system has so much fuel for the regulation of Th17 cells that massively ramp up inflammation.
Dann muss ich auch wissen, dass mein Immunsystem damit so viel Zündstoff hat für die Hochregulation zum Beispiel von TH17-Zellen und die massiv eine Entzündung hochschrauben. Das heißt, ich rufe über diese Fehlernährung, ich rufe über diesen Schlafmangel.
This malnutrition, lack of sleep, and psychological stress trigger up immune cells to get ready and activate an information happening all at once. And that is highly interesting.
Und das ist hochinteressant, weil man durch so einen Immunstatus, und ich finde, das ist wichtig, wir müssen nicht erst ärztlich auch wirksam werden, wenn das Kind im
Because once we go through such an immune status, and I think that is important, We do not have to become medically effective. We can recognize much earlier where its self-regulation is, because I must leave it to the immune system, always, please.
Is it still in balance?
Right.
You can turn this into an early warning system. That means if your immune system really is no longer right on this basis, then this and that could happen. So periodically, I have to make myself an immune system control check.
Right.
And then, can I regulate?
Exactly.
That's interesting.
That is highly interesting, because it happens in a time when we must protect ourselves, perhaps by vaccination, against something. Then I must say, I always have the best defense myself. I can also trust this, because that has certainly presented me so far with a lasting life, a great balance and a great strength. It has always put illness aside, but illness always needs triggers. And before it's permanently there, an incredible amount has happened in me. And the great diversity of the microbes, the great diversity of the bacteria, the great diversity of an ecological balance, which today in 2022 we do not even come close to perceiving and accepting, is the key to health. And if you do a dark field analysis, you see how the white blood cells clean up and clear. You see how lymphocytes work, but you also know how they work less efficiently under electrosmog, under Wiechel and stress. Here is not only about numbers, but also about awareness of how not to harm my immune system. To whoever still sleeps with Wiechel at night, I have to say that he should not be surprised that he will be attacked tomorrow.
As Dr. Klinghardt said so beautifully in the program, the cells also just want to survive and are so stressed from the outside. And if they give us a signal, the host, how can we listen to the signals?
Precisely. And that's highly interesting. And as I said, we must understand the regulation of the cells to be able to read an immune status. This can be seen more in the direction of extracellular stress, where bacteria go in the direction of intracellular load. These are tumor processes. They are viral processes. It's very interesting to recognize this as a therapist and to intervene in these processes.
Today, who practices microimmunotherapy?
Microimmune therapists.
Is that what it says?
Yes, because you must have specially trained doctors who understand the whole question of virology today. In former times, one made an antibody, and they said they have increased antibodies, and they had once measles, they had rubella, and so on. Today's classification is completely different, because in the context of the microimmune therapy, we need the exact parameters of the immune system to say, for example, this is an Epstein-Barr load, even without any symptomatology. And Epstein-Barr, just to take this herpes virus as an example, is a persistent infection, tests the immune system and tries to attack and leads to various symptoms, of course, over time. Or its reactivation repeatedly whenever you're weak. Condition herpes shingles, so it was the accident, it was the shock that triggers it. And then I, as a person, set the signal 0 for immunity. The body must now confront the stress and thus does not have the same energy. This is always the priority of the body. It decides where to direct its energy now and what its immune tasks are.
Is this a blood analysis, basically taken and sent to the lab, and then years later I discuss the results with my therapist? and she says there are dangers due to my blood parameters, and then we can add something to stabilize the immune system.
Exactly.
Ah, that's quite cool.
Yes, it is cool. An unbelievable possibility has opened therapeutically. How many people suffer from sleep disorders? These are in part inflammation processes that take place, which can be regulated via micro-immunotherapy. It's really all about inflammations at the physical level. For example, the papillomaviruses that can provoke cervical cancer wakes up from inactivation. It's all the whole cytomegaly, herpes viruses, chlamydia infection. It's unbelievable. There are microimmune remedies to regulate the sheath inflammation in multiple sclerosis. There is the great remedy for the Parkinson's. So to my mind, it's important to a physician or therapist to understand these interactions. Then it's great to have something in hand that shows these connections.
Yes, it's already unbelievably difficult to see these connections in such a way that consistently generates awe. I know I've just dealt with it a little, and I can no longer get out of the amazement. These connections are phenomenal. But again, microimmunotherapy is not only for people who want to adopt a holistic approach to their health, but also for those who are healthy and want to stay that way.
Just a simple check to see how your immune system reacts could be the signal that we can optimize something in your system. You don't always have to do a large immune status check. A simple, healthy, differential blood count will work for our purposes. There you can see the leukocytes and the lymphocytes. If the lymphocytes are too low, then the large microimmune agent, 2-LED, will first lift me now, starting exactly there to build up this reduced defense again. For example, this is what I like to give to every older person who is in his convalescence or regeneration, a strength perhaps not so strong, but enough to adapt to the stresses of life. I've never vaccinated anyone against the flu, but I've always tried to support natural defenses in addition to providing all the things that the immune system needs, so that it can build up again and again.
Before we reach the end, I have one more question. I hear again and again that mineral deficiency in the body, zinc or God knows what, can also lead to immunodeficiency. And of course, immunotherapy analyzes this as well.
These mineral deficiencies are just as important to detect as intracellular zinc in addition to the immune status.
This is always done by microimmune therapists who can then react appropriately. Yes, indeed, for sure, the idea to convey here for our viewers is health prevention. That is, to do all you can to stay healthy. The approach we discussed here is still the cheapest means of health prevention. Even if we're already healthy, a professor once told me, don't save money. Either you spend a little until you're 50 or 60, or you spend it all on one occasion, but in a less than ideal quality of life condition. Thank you, Petra, for your presentation of microimmune therapy. And to all, strengthening the immune system has now become the key concept. And I hope that we put much more energy into developing this concept. With all the corona phases, this has become quite a news item.
Ja, lassen wir das Thema. Alles Gute bis ein anderes Mal und auf Wiedersehen miteinander.